The Renewing Health project is one of the two, what we call large-scale pilot in the area of e-health. So definitely is strategically extremely important for us. It's one of the pilots that actually aims at contributing as well to achieving one of the targets set by the digital agenda for Europe, so ensure wider deployment of telemedicine.
The Renewing Health project is for me the missing link. After having achieved policy frameworks, having built up the infrastructure which we need, now it's time to go at the regional level to have innovation, process innovation, and build up on a large scale approach the new healthcare system which we need.
Renewing Health project is a large-scale project funded by the EU Commission and the participating regions, testing out, first of all, an evaluation model for telemedicine services, and secondly, trying to look into how you can deploy large-scale different kind of telemedicine services.
The Renewing Health project is an exciting series of randomised control trials which will contribute to the evidence base in a number of areas of chronic disease. There is an extensive literature, so it will make a contribution. It may not provide the definitive answers to questions about the use of e-health and telemedicine in chronic disease.
The Norwegian pilot is based upon a self-help tool that's on a mobile phone, on a mobile unit. For the patient themselves, we hope it will be motivating and giving them better empowerment. Empowerment is a key word here, to when they get better overview of how the situation actually is. And all the patients, they always bring this to their GPs. Now this is also a part of the study, but even before the study they would like to discuss it with their GPs, and the data on the phone provides the GP with a lot more detailed data on the patient than they would normally get from just measuring the HbA1c level.
So this is about creating video conference connections to the patient's home. The patient gets the suitcase at home. As you can see, it's very simple. It has 3 buttons. It has power on and off. It has an emergency button.
Telemedicine is the only possibility to deal with the upcoming and increasing treatment processes, especially in the chronic diseases, people becoming older and older, and also with the increasing possibilities of the medicine in the treatment process.
It's about telemonitoring and health coaching, and it includes diabetes 2 patients and then heart disease patients. They don't have to do anything but just measure, and all those results, they go via Bluetooth to the central receiver, and they can see it on their own computer, and their health coach can see the results.
We have developed applications that makes that empower the patient to do much more by themselves. So they get instructions by video from the healthcare professionals what to do. They can measure both the preventive healthcare and also medical diagnosis measurements, and they can report it, and they can view the results on graphs on their computer. And now when you have made the transfer, then you push the send button. Yeah, so they can look at different kind of messages here.
Patient engagement is probably the most fundamental, under-recognized, underutilized tool we have today. We in healthcare have typically been the expert clinicians and told our patients what they needed to do, not realizing that we're a small part of their lives, and what they do day to day makes the most impact on how their life turns out.
The regions that today are in Renewing Health are known a bit as a front runner in this type of services, but they can actually also, their learning can be transfer to other regions.
We have actually been able to conduct more trials that goes across regions than we expected. We can also see that some of the service that has ended the trials, the collection of data already, is transferring into to daily production faster than we expected.
We absolutely intend to make it something that's going to be followed up, and we work a lot also outside the Renewing Health project to actually make this a reality.
The Renewing Health pilot in Catalonia can help the regional strategy for e-health in trying to provide some data for evidence in e-health services provision for all the region in Catalonia.
The digital innovation in healthcare has been slow to take hold, and there are many reasons for this. Maybe in particular it is the interoperability problems of the equipment. There is a lack of business care model. There is lack of evidence for return of investment, and all these create problems to scale up the telehealth services.
The quality of the evidence is simply not high enough. So we have therefore developed an assessment framework called MAST, Model for Assessment of Telemedicine. By using this model, we hope to be able to produce results of high scientific quality in the pilots, in Renewing Health, results that will be useful by decision makers in Europe when they have to make decisions on whether or not to invest in telemedicine.
I believe that telemonitoring is in Germany one of the growth market. Experts estimate that in the future, till the year 2020, we have 20 billion euro in the budget for telemonitoring.
The Veneto region considers telemedicine services essential as outlined in our social and healthcare planning. What we expect from this experience is to have the opportunity to test and validate telemedicine services involving patients so that this pilot can become easily routine services available in all our region.
The critical success factors will be to be able to demonstrate that one or more of these e-health and telemedicine interventions is cost effective in improving patients' health in chronic diseases, and that will be a very important thing to show.
By doing this, contribute, as I said, to really scaling up cost effective and useful service in the best interest of European citizens.